Thank you very much, Helen. It's lovely to be here, lovely to see you all. And hopefully I will manage to do what Helen has suggested I will do. I've actually written a script for today because, like many of you, I'm a bit out of practice at this, so just to make sure I don't forget anything important. Right. So it's been really an interesting time in the life of the City of Leeds over the past few years, as it has been everywhere. And it's been a real pleasure to learn from many of you as we've worked together not only to act in the best interests of the communities of Leeds, but also to understand and reflect on those actions through discussion and research. And I think it's just worth saying at this point that, research is quite a mysterious thing and people can be quite intimidated. What does it mean? What is it? And for me, and for the pieces of research that we're talking about, which are the reports, some of the reports are on that slide there, what we mean by research is a kind of focused and intentional story gathering, set of conversations, set of interviews, nothing more mysterious than that we look at with what we hope is as a dispassionate but analytical mind as we can gather. It's quite difficult to be dispassionate in the current situation, as you all know. We're here today to think about what we've learned through our experiences of COVID-19, what we've learned about ourselves, our neighbours, our communities, and working together for our city. I see that they're saving the energy in here, Andrew, so bracing ourselves for the cost of living crisis. And as we're here to think about what these lessons might offer to resource us as we face what is, for many, an unimaginable winter, we will do this by listening to the experiences of navigating COVID-19 in Leeds, as told by representatives of the faith, voluntary and statutory sectors. And we'll hear the experiences of a wider cohort in roundtable format. And hopefully we'll make new connections to resource the city as it prepares to care for its most marginalised citizens over the coming months. Crises are by definition extraordinary events. They're crucibles in which rapid social change is catalysed. Look to any historic pandemic and you will learn that the worlds that they've left in their wake are fundamentally changed. In preparation for today, I've spent time going back over research notes and reports that I and others wrote in that intense period of lockdown in 2020. This work concerned the experiences of parish clergy, of chaplains in hospitals and care homes, clients at St George's Crypt, and various Leeds-based citywide partners on the front line of COVID response. The data sets are diverse, but what I want to do is just pick out a couple of themes that appear across them to look at their relevance within the wider context and their implications for thinking about cross-sectoral collaboration today. The first theme is that of marginalisation, prejudice and discrimination, and the need actively to work against that in the city. And the second is the importance of understanding the complementarity of what different actors from different sectors and faiths with their distinctive networks, skills and access to communities offer. To revisit the words and feelings that were expressed to me in 2020 through a process of story gathering feels a little bit like time travelling, back to a place which I know for most of us, if not all of us, we experienced as disorientating, and during which we all had to face fundamental truths about our nature, ourselves, and our society. As historical narratives of our national COVID-19 pandemic and response take shape, as the success of the vaccine rollout takes precedence over what many perceive to be the cavalier attitude towards loss of life in the early pandemic, as bereaved families petition for justice, it's important to remember some of the things that people were feeling and thinking and saying in 2020. More and more it can feel like research, in which we revisit the words and feelings that were gathered in real time, is one of the few tools that we have to fight propagandists and demagogues who rely on our lack of information or memory to make their case. For that reason alone, perhaps research is worth undertaking. Early on in 2020, I spoke to religious leaders in Africa with whom I'd worked on HIV over many years. At that time, people in the UK were highly reluctant to consider COVID-19 as a long-term event. "We'll fight this in 12 weeks, said our then Prime Minister. Popular public health literacy seemed shockingly poor. Having worked on public health for many years, I personally was horrified at how little seemed to be being done and how little people around me seemed to understand what we were entering. This was not a 12-week problem. African religious leaders, many of whom under the challenges of HIV and Ebola have become public health experts, who see public health activity as part of their core mission, told me to look for the social inequalities, which would be laid bare. Sure enough, it quickly emerged that levels of severe illness and death were disproportionately high in Black, Asian and so-called minority ethnic communities. I hate all that language, so highly problematic, part of the problem actually. It turned out that those living in socio-economically deprived areas, particularly those families in tiny flats with no outdoor space, were disproportionately negatively impacted by lockdowns. Race and class emerged, as they always do, as twin pillars of vulnerability. Within the context of the research in Leeds, we were able to witness the subtle implications of these intersections of racism and classism. Prejudice comes in a number of guises. Interviews with public health professionals in Leeds as early as April 2020 reflect their despair at a national public health campaign against COVID-19 that was only released in the English language. I mean, can't quite believe that actually happened. Limiting access to health protective information in majority populations in Leeds and Bradford. Many public health workers spent hours of their own time translating materials into local languages and reinventing wheels that could have been state provided. Research undertaken on the community care hubs model by Voluntary Action Leeds, which we'll hear about in due course, demonstrates the great success of a looser funding structure in which money for aid from Leeds City Council was quickly devolved to community-based organisations within local neighbourhoods so that they could reach people on the ground. But this research also exposed the ways in which the mechanisms which had governed access to food aid in the pre-COVID system worked to mask the realities of needs on the ground. In the earliest days of lockdown, food was made available at care hubs without restriction, and referrals were light touch. Individuals and families, including child-headed households, which had previously been invisible to the authorities out of legal necessity because they had no recourse to public funds, began to emerge. These people previously didn't exist, and they had no access to food. Similarly, clergy ministering to their parishes in urban areas in the early weeks of lockdown reported their shock at encountering what one cleric called the invisible middle of their parish community, people who'd never been known by the church or been seen within the geographical parish, but who turned up in March 2020 in dire social and economic need. For many frontline carers, the stark realities of economic precarity in which people had existed under 10 years of government austerity was a profound shock. COVID-19 and the lockdowns both exacerbated the needs of vulnerable communities and exposed the inequalities that ordinary time had concealed from local institutions. Val's work on community care hubs demonstrates the tacit ways in which race and class discrimination subtly played out in some of the hubs, exposing the complexity of managing volunteers, themselves ordinary people with their own assumptions and at times biases. The willingness of people to give their time and energies in Leeds during 2020 is undoubtedly one of the great positive narratives of the pandemic, and it resourced those who offered their time in a situation where they were otherwise feeling very helpless, and we know this from the research. But it's not an uncomplicated story, and it's worth saying in terms of the value of research, there's no point in telling an unadulteratedly positive narrative where listening to the challenges might better inform what we actually do better. In some of the interviews undertaken, hubs talked about struggling with the perspectives of volunteers who perceive certain clients to be deserving of food and certain clients as undeserving of support. There were some reports of profiling on the part of volunteers as they decided who was and who was not eligible for food, of calling out people as looking or sounding like they did not come from the neighbourhood, and querying people whom volunteers felt turned up too frequently to be authentic. These ideas about who makes a deserving recipient of help were illuminated further by research conversations at the crypt. One staff member had struggled with the minority, and this is a minority of volunteers, but I'm trying to think about, there was a lot that was done, and things were done really well, but what do we need to learn, and how do we need to do this better? And so I'm sorry, it's a bit of a negative voice really, isn't it? Anyway, you'll just have to bear with me. One staff member had struggled with the minority of volunteers over the years who took umbrage at what they perceived to be the ingratitude of recipients of food parcels. This staff member talked about an asylum seeker family who were given a catering-sized tin of beans and a loaf of sliced bread on a visit to the food bank. When they asked what they were supposed to do with that, they were told by a rather frustrated volunteer that it was to feed their children for the rest of the week. When they indicated that this food, which culturally would not be acceptable to their children for 3 meals a day, and that they had no fridge in which to put the leftover beans, they were cast by the volunteer as ungrateful, as the wrong kind of client. And these are just some of the ways in which the intersections of race and class play out on the front line. Sometimes the need of people and volunteers to do good serves to perpetuate stereotypes about those clients on the receiving end, which in turn further marginalises and dehumanises them. As you all know, the reasons for people's vulnerabilities are primarily the result of unjust structures and factors beyond their control, such as race, class, gender, the geography of birth. In a conversation with Hope Backman, who undertook the research for Voluntary Action Leads, I asked how the research might be developed and what the strongest finding might be with implications for policy and praxis. She suggested that the training and resourcing of volunteers in relation to structural inequality and implicit bias might be the most important thing that could be done by the sectors working together to improve the delivery of care at the local level. While so much value is placed across the sectors on telling stories of success and the success of the Leeds mobilisation in the context of COVID-19, if we don't look more closely to understand failure, we come away with little to improve what we're doing. At best, a researcher's accountabilities are to the integrity of the analysis of the stories that they're hearing and the representation of the range of voices that the researcher hears. I would like to say that it takes a certain organisational confidence to hear and respond to the criticisms that researchers bring in. And I understand that, and I commend all organisations who welcome researchers into their mix. You never really know what you're going to get when you let one of us in, and I know that that can be difficult to hear as well. So, props to those who invite researchers in. In thinking cross-sectorally about the research that's been done in Leeds, it's clear that it was the collaboration in which each organisation offered what they could to the city and their communities, resourced by the funding structure set up by the council, that created such a strong impact. The research from both the voluntary sector and the faith sector indicates the distinct nature and range of assets that were offered up across a diversity of organisations and leaders in Leeds. Much of the focus of Voluntary Action Leeds' research is on tangible and material needs and assets, on networks, on money, on flows of aid, on the bureaucratic and administrative capacity of organisations to deliver through established community networks, and that's a great story. Research undertaken on the Christian response, and that one of these reports is specifically about the Christian response, mirrors much of these findings. Churches and other places of worship can and frequently do operate like and have the same concerns as secular charities. And yet there's another set of intangible assets that church leaders hold which came to the fore for many during the COVID-19 pandemic. You're likely aware that in the early days of lockdown, Google searches around how to pray skyrocketed around the world. I mean, that evidence is very clear. And this invited many researchers to comment on rising religiosity in the context of COVID-19. Many years of researching religious belonging make me highly sceptical of drawing linear connections between prayer and religiosity, or really anything and religiosity. But it was certainly the case in my own work that clergy reported an increase in agnostic people coming to them to talk about death and to ask about faith. Interviews with staff working at Church House in London revealed the magical thinking that COVID-19 generated, as people across the UK with no religious literacy sought to find the best protection against COVID-19 through drinking bleach, that came up a lot, not surprisingly, through wearing amulets or jewelleries or protective jewellery, or through particular kinds of prayer. So this is people in the UK going to the national church to ask, what can we do to protect ourselves from this plague, basically, in the very early days. Faith leaders and chaplains revealed the considerable work that had to be undertaken to manage the often profound fear and anxiety at the existential interruption of COVID-19 from ordinary people on the streets. Lockdowns and social isolation generated a lot of spiritual and pastoral as well as material needs, as we know. Chaplains in care homes and hospitals became the only outsiders allowed in to visit people. They found themselves ministering to new constituencies, as primary liaisons to patient and client families, and as support to care home and hospital staff dealing with unprecedented numbers of deaths and unprocessed grief. And it was this work that religious leaders, as ritual specialists, as professional pastoral carers, and as those with theological frameworks for thinking about meaning, life and death in a society in which death has largely been relegated from public view, that they were ideally placed to do that work. Each sector has a different set of capacities and a different role to play in building the compassionate city. Whilst faith organisations and charities often have particular strengths in pastoral caregiving and are trusted community organisations at the grassroots, the statutory sector offers other skills in terms of resourcing and professional processes for commissioning, safeguarding and procedures. And it is the very distinctiveness between organisations and sectors that creates elasticity and responsiveness in the system. We all need the other bits of the system to provide that kind of ballast. During COVID and beyond, different organisations have used their distinct offerings to contribute to a mosaic of support. No organisation can or has to do everything. Rather, organisations must recognise and understand their assets and ensure that they are being applied to maximum effect. They must know what they are good at and be realistic about what they are not good at. They must work out where others can support with gaps in expertise, networks, resources or institutional trust. And they must build connections and networks with those who are offering something different from them. They must envisage themselves as part of an intangible and interconnected web of care and recognise and draw on each other's strengths. And only through that can we continue to work towards building the compassionate city. Thank you.